Nick Garulay here with My Florida Green. Today, we're going to talk about RSO, which is short for Rick Simpson Oil. But first, let's talk about some history on Rick Simpson. Rick Simpson was a engineer that worked in a hospital. In the late 90s, he fell off of a ladder. He was high on a ladder, a 30-foot ladder, so high being high elevation, not high off the plant, fell about 30 feet and bumped his head, and severe traumatic brain injury occurred where he obtained tinnitus, which is a severe ringing in your ear. So he went to the doctor. The doctors wanted to treat with heavy narcotics, which he was against. And he started to extract the natural oils from the marijuana plant and started to treat himself, and was able to relieve his symptoms 100%. So with that said, he started to come up with his own extractions and discovered that the whole plant extraction, which is now the extraction with the label RSO on it, and it's a darker oil, he was able to, or discovered that this oil is very healing for the body. So in the early 2000s, Rick was diagnosed with basal cell carcinoma, which was lesions on his skin. He went to the skin doctor and they cut one out and discovered that he had 3 or 4 more that he needed to get cut, but he did not want to have the holes in his skin. So he took his Rick Simpson oil and applied it topically, and within 4 days, the basal cells went away, and also the scar from the first one they had the cut and biopsied was actually healed as well. So he discovered that this was going to be his natural treatment moving forward, and that was the birth of the coin name RSO. So there's some history on Rick Simpson oil. So this is a natural extraction, all parts of the plant, and this is a darker fluid. So you'll see if you do get an RSO concentrate in a syringe, that it is going to be a darker color because this is all parts of the plant with a full extraction. So a little history on how THC works within the body. THC binds to the receptor, therefore it is psychotropic, where CBD will block the receptor so it can reverse the psychotropic effect of THC. Rick Simpson and cancer is associated very well because Rick Simpson cured himself of cancer with his oil. So there is a Rick Simpson protocol that is in the medical space, which we're going to educate you on here next. And it's going to show you how you can ramp up and build THC up in your system so you can build a tolerance and eventually saturate your body with as much THC as possible. Now, why would you want to do that? If you are fighting a cancer, regardless of what kind of cancer it is, the idea is to get the THC to the cancer cell, which can cause apoptosis, where the cancer cell can eat itself from the inside out. I've seen it live in a petri dish, and it is pretty amazing. CBD can actually block a cancer cell from metastasizing, so it's kind of like a 1-2 punch. So the idea is to saturate your body with as much THC and CBD as possible to eradicate the cancer and cause apoptosis. There's no guarantee that this happens, and obviously skin cancer is the easiest because you can apply it topically. Once you get into pancreatic cancer, liver cancer, breast cancer, lung cancer, the idea is to saturate your body with as much of it as possible, and we're going to show you how to do that next. All right, so the product that I'm holding right here is RSO from Move. So this is a full extraction. It's about 900 milligrams of THC, so this will pack a pretty hardcore punch as far as psychotropic effects. So you want to be careful ramping this up. So what we're going to do is we're going to show you how to capsulate this to follow the Rick Simpson protocol. Again, this is a RSO syringe from Move. Okay, it's a very strong product, okay? What I do is I have a hot water here because if you notice, when I pull the cap off and I push, it barely anything comes out, right? So for our older patients, arthritic patients, it's gonna be a little difficult to maneuver with this. So I have some boiling hot water here, and I'm just gonna dip the top, or actually the entire syringe into the hot water to loosen it up just for a couple of seconds here. Usually we'll do the trick. While this is going on, I'm also going to open up a capsule here to give a demo. All right, so we're pulling it out of the hot water. Should be a lot more manageable now. And we have our capsule that I've already taken the top off. And we're going to start with week 1, which is start with 3 doses, about a half a rice grain. So what's a half a rice grain? Well, you can kind of determine that, but figure about the size of a piece of rice and do about half, okay? So this is our first dose, okay? and I'm going to put this capsule back together, and this will be in our week 1 pile, right? So you're going to take that 3 times a day for the first 7 days, so that'll equal about 21 capsules that you'll need to make with that very light rice grain, or half a rice grain size. Weeks 2 from 5, you're going to double your intake every 4 days. So you'll basically take a capsule and put a full rice grain size in here. Okay, so we'll put that in week 2. So you're going to double this dose every 4 days. So you're starting to ramp up. What you're doing is you're kind of building your tolerance so that you'll be able to consume and metabolize the THC. Because again, THC will bind to the receptor, which can cause the psychotropic effect. So the more THC that layers onto the receptor, the THC will start binding to the other THC. Therefore, you'll get less psychotropic. So from weeks 5 to 12, you're going to be consuming an entire gram. All right, you don't want to do this all in one dose. Just to give you an idea of what an entire gram is, it's this entire syringe, right? You want to consume an entire gram every day, weeks 5 to 12. So now you're really saturating your body with as much THC and CBD as possible here. Okay, I would suggest filling up maybe half of one of these capsules and doing that times 4, so you're not taking such a massive dose all at once. And then definitely clear your schedule. This is going to be a commitment where you're going to want to sit on the couch or sit in a lazy boy with a controller in your hand and kind of enjoy the ride. Okay, so this is a 12-week program. You're starting week 1 with a half a grain of rice, taking it 3 times per day, doubling up every 4 days, where you're really saturating your body with as much as possible, and then eventually consuming a gram. So you take about 4 capsules like this that are pretty full with the cannabis extraction. And by the time you are done, you should have attacked any cancer that is in your system, as well as maybe alleviate some symptoms of severe conditions like ALS, Parkinson's, and other cancers, and even PTSD. This is a regimen that has been very effective for our patients, and we're happy to show you how to do it. So please follow us for more regimens, as we'll be posting them soon. Take care.